the plate is not going to be moving all around the table for them. It will be staying locked in one stable position. An occupational therapist is a consultant in your health care settings who will evaluate patients for use of different assistive devices. And it's important because it takes time and effort for patients to be trained in the use of these things, but it does help them be much more independent than otherwise they may be. So be patient with them and encourage them to use the devices, because in time they will become quite proficient at them. You have a key role as a caregiver. Some of your responsibilities are to honor patients' requests for food preferences and substitute when you can. If a person is not eating a vegetable, it may not be that they just aren't hungry. It may be that they don't like that particular thing. Cooked cabbage, spinach are items that are not real crowd pleasers, so trying to get something else that might be more palatable, like carrots or peas, encourage them to try something else that you'd be willing to find a substitute. Always follow the patient's special instructions to be certain that you're not giving them something that could do them harm, particularly, again, if they have swallowing difficulties. Use the ordered thickeners consistently. That means anytime someone with a swallowing problem is going to have a liquid put into their mouth, you would need to use the thickener. That would be when they're getting their medications and need to have a liquid to drink with the medications. A thickener would be needed. If they're going to be brushing their teeth, you would need to add thickener to any water that goes into their mouth as well. Provide for a pleasant atmosphere. That goes a long way for the individual being able to eat better. Provide encouragement to eat and give them praise and physical contact. Research has been done lately that has shown that when physical contact in the form of just patting their forearm, for example, or giving them verbal praise, those folks tended to eat quite a bit more than those that they didn't do that for. So by giving them encouragement, by saying, "Mrs. Smith, you did such a good job of eating today. Good job," goes a long way for encouraging them to eat. Never force a person to finish everything on their plate, however. The Clean Plate Club rule that you may have grown up with does not apply in a healthcare setting. Make sure glasses and hearing aids are on so that they can see what they're eating and that they can hear these words of encouragement. Also, take time. I think that's probably the most important thing. Allow patients to taste, chew, and swallow their foods. This is the highlight of many of the clients' day. So give them time to savor this experience. Some patients in the past, and probably still in the present, receive pureed foods not because they need them, but because they're slow. It's easier to give someone a pureed item such as mashed meats and vegetables than it would be to give them a salad, for example. But it is never appropriate to alter a patient's diet unless they need it for some particular reason, just for our convenience. So be certain that it never, ever happens. And in the past, it has been my experience that on occasion, some caregivers have taken a syringe such as this. This is a 50 cc syringe, have taken the plunger out of the syringe and have put food in it that has been blenderized and put in liquid form. And then they put the plunger back in after the liquid food has been placed in it and have forced the person to eat the food in that manner. That certainly is disrespectful and does not show any dignity for the individual and never would be tolerated. And hopefully never is tolerated in today's healthcare settings. If you would ever see that happen, make certain that you report that to the nurse. Things to report to the nurse. any problems with teeth or dentures so that a dentist can be contacted and the problem remedied. Be sure to report any coughing or excessive swallowing, drooling, or any other signs of dysphagia. Report pain. If patients are having pain, chronic pain, the nurse can give them something for it at 30-45 minutes prior to mealtime so that by the time their tray arrives, they can be much more comfortable and more likely to eat. Report any nausea or vomiting or any heartburn. And finally, report any poor appetite that the patient might be experiencing. As caregivers, we must all do what we can to help patients receive the nutrition that they need when they're recovering from an illness and for living a very healthy, happy life.